afternoon, everyone. Welcome to Focal Points. Today, our two guests are brothers, Dr. Ben Javid. Did I say that right?
Yeah.
Javid. Dr. Ben Javid and Dr. Shawn Javid. They are biological dentists, and they have a lot of interesting things to tell us today. So, doctors, please tell our audience a bit about yourselves.
Well, obviously, you mentioned we're brothers. That's the start of it. And but uh, but yeah, we kind of evolved from mainstream dentistry and mainstream medicine to what's called biological dentistry. It's something that probably most people are not familiar with. I mean, a lot of people maybe listening to this podcast might be because of the work of integrated medicine and functional medicine overlap with biological dentistry. But we have for our focus in biological dentistry is more about the whole body approach. In other words, the connection between the mouth and the body, how the mouth influences systemic health tremendously, looking for root cause of problems rather than symptoms. We pretty much are a change from the mainstream approach of treating just symptoms, of course, and treating the health in silos, where there's doctors for different parts of the body, and they treat the body as a separate unit, kind of like a car. When you have a bad tire, you change a tire, or you have a bad carburetor, you change a tire. That's our approach. Obviously, is different because we believe the future of not only health or oral health, but health care in general is this more holistic approach where you look at if you have heart problems, you should be looking at the mouth. If you have skin problems, you should also be looking at the mouth, because a lot of times that's where toxicities are coming into the body, and also other ways the mouth body connection influences the body's a lot of times degeneration, chronic health issues, cancers. So we are coming from that perspective, a lot of basis in nutrition, micronutrient levels, microbiome. These are all fundamental parts of biological dentistry, combining that with some ancient wisdom like meridians, and new technology that's not really being utilized in mainstream medicine or dentistry, like sound light therapy, and technologies like cone beam technologies we'll get into. But again, it's a different approach. How would you describe it, Shawn?
I mean, that's a perfect way of putting it. I mean, in a nutshell, I mean, I usually like to say, I mean, we started the practice. I started the practice 30 years ago. Ben and I have been practicing together now for 20 years, which is small body now, which exactly what Ben mentioned. But in a nutshell, dentistry, the way I practiced was, dentistry only looks at getting you functional and without, so you can eat without pain. They don't look at toxicity that we're introducing into the body. Materials is very important. So the biological dentistry in a nutshell is we are very careful what materials we're introducing into the body. That has to be biocompatible. And we have to make sure we're removing toxicity out of the body very carefully, not to expose people to toxins like mercury fillings and metals, and a lot of toxicity that's infections.
Infect the teeth.
And we use something called a cone beam CT scan, which is really critical, which we're going to talk about, because normally two-dimensional X-rays, a lot of things are missed. So that's our tool that we use. That's very critical. We can't really diagnose anything without it. To kind of find hidden infections in the jaw, that's the gateway to the body that, like Ben was talking about, that causes systemic issues. So people now at Smile Body, we're really privileged and blessed that people trust us. They're flying in from all over the country now to Smile Body in LA, and we're basically diagnosing, finding things, finding toxins and infections in the jaw, and relieving them from systemic issues. At least get one thing out of the way, which is a gateway.